Pedia lax is used as a laxative. It works by causing the intestines to hold more water, which softens the stool. Pedia lax rectal is used to treat occasional constipation or to clear the bowel before rectal exam or other intestinal procedure. How to take Pedia lax. Use Pedia lax liquid exactly as directed on the label or as prescribed by a doctor. Do not use in large or small amounts or for longer than recommended. Overuse of a laxative may cause damage to the nerves, muscles, or tissues in the intestines. Do not take a rectal suppository by mouth. It is for use only in your rectum. Wash your hands before and after using a rectal enema or suppository. This medicine comes with patient instructions for safe and effective use. Follow these directions carefully. Ask your doctor or pharmacist if you have any questions. To use the suppository, remove the wrapper before inserting the suppository. Avoid handling the suppository too long, or it will melt in your hands. Use your finger of the applicator provided to insert the suppository. Lie on your left side with your lower leg straight and your upper leg bent. Gently insert the suppository pointed tip first into your rectum, about 1/2 inch for a child or 1 inch for an adult. For best results, stay lying down for a few minutes. The suppository will melt quickly and you should feel little or no discomfort while holding it in. To use the enema, remove the protective shield before inserting the enema tip. Lie on your left side with your lower leg straight and your upper leg bent. If giving this medicine to a child, have a child kneel on the floor and then lower the chest forward until the side of the child's face is resting on the floor. Gently insert the tip of the applicator or bulb syringe into the rectum. Point it toward your navel belly button. Don't force the applicator into the rectum or injury could result. Slowly squeeze the bottle or bulb until it is nearly empty. For best results, after using Glycerin rectal, stay lying down until you feel the urge to have a bowel movement. This medicine should produce a bowel movement within 15 to 60 minutes after using the suppository. Don't use Glycerin rectal more than once in a 24-hour period. Call a doctor if this medication does not cause you to have a bowel movement within 1 hour after use. Contraindications: appendicitis, blockage of the stomach or intestine, the inability to control a bowel movement. Precautions: don't use when abdominal pain, nausea, or vomiting present, unless directed by physician. Frequent or prolonged use of laxatives may result in dependence. Rectal bleeding or failure to have a bowel movement requires physician care. If constipation continues after 1 week of use, contact a physician. Contact physician if no bowel movement within 1 hour of using this product. Keep out of reach of children. If swallowed accidentally, get medical help or contact Patient Control Center right away. Side effects: get emergency medical help if you have any of these signs of an allergic reaction: hives, difficult breathing, swelling of your face, lips, tongue, or throat. Stop using Glycerin rectal and call a doctor at once if you have severe stomach pain or cramping, rectal bleeding, no bowel movement within 1 hour after use. Common side effects may include loose stools, nausea or stomach discomfort, rectal pain or burning.